everybody, it's Dr. Warren here at Kalkstein Chiropractic. I'm with Mr. Michael over here. Mike is a former soccer player, correct?
Correct.
Correct. And you came in about a month and a half ago with some pretty severe low back pain that had been chronic. It hadn't really let up on you at all. Is that correct?
That is correct.
Okay. And tell me a little bit of how you got to that point in terms of your low back and it being aggravated.
I think it was just kind of a lifelong issue that only got worse as I got older, and the more stress I put on my body, the worse it got. It was pretty much a knot in my lower back 24/7.
So Mike's like a no-nonsense kind of guy, which I really enjoy working with that type of person because they'll tell me what's helping them, they'll tell me what's aggravating them, they'll tell me if I'm not doing anything good for them. And so when I get feedback from Mike, it's always steering me in the right direction towards care. So I can appreciate that. So works hard. He's got two girls at home.
Correct.
Keep it up with them as they get older and they're running around a lot more. And then just kind of life activity, work, weekends. You need your back. You need it to be feeling good and mobile. And sometimes we get into a habit where it just kind of starts to take these steps down. And I think everybody can relate to that type of issue wherever in the body, right?
That's very true. My breaking point, I was doing flooring at the house.
That's right.
And I put in the subfloor, and I couldn't walk for a week. And I still had to lay the entire floor, so like 700 square feet. I came in here for a few weeks, and I actually laid all the floor that weekend and was able to get out of bed every morning and get back to work. So I'm just very impressed with the progress I've made to date. It's pretty remarkable.
Awesome. Yeah, I'm happy to hear that. So he's doing a combination of dry needling and PT and chiropractic care. So he gets dry needling done, which helps with muscle tension in his low back. We've switched over to an old injury or a problem area for him where he's kind of had this chronic tension in his hamstring. And now I won't jump down a literature rabbit hole, but it can be really closely correlated with lower back pain as well. But so I'm just doing some simple ART. He had dry needling done today for the first time on his hamstrings. And then I'm going to show you how I adjust him, get him moving better, and then just so you can maybe see if this is something for you out there, wherever you are. If you're in the Baltimore area, you're welcome to come in here, obviously, but finding a good chiropractor or PT or osteopath that does this manual work can really make a huge difference in terms of getting back to just functioning well and getting you, maybe if you just need that step to get towards the direction of a strength program, giving you the foundation to do it can be helpful. All right. Mike, you can relax your shoulders, let your head rest, and then I'm just going to treat you from here on out, okay?
Sounds good.
So you'll feel pressure in the hamstring. I want you to straighten out your knee as much as you can. Good. So 3 major hamstring groups I'm going to be working on. One big one here, and then 2 on the inside. Come up. Alright, you can relax there, Mike. So this song is definitely running through my head a lot this week. My wife is expecting any day now. And it's like I'm just keeping my phone close by, not worrying, just enjoying every single day up to this point. I'm so excited.
Keep the ringer on loud.
On loud. She's already tested me once. Just to mess with me. It's funny. And I passed. But only because Nicole saved the day and went and grabbed my phone off my desk. She doesn't know that. She doesn't watch this video, so I'm good. Relax. A little deep pressure here. tighter on this side, Mike.
Tell you, if you're often impressed by your wife, you'll step that up a notch after the baby's here.
I hear you. She's pretty amazing, I'm not gonna lie. She's a queen. I can't wait to see her kind of shine her in that moment too. That's what every dad tells me, like going in, is like, you're just gonna be so impressed with your wife and what she's capable of. For sure.
I distinctly remember my wife not talking during the early parts of the labor, and then she got the epidural and wouldn't shut up after. Just like changed her mood.
Night and day.
Yeah. She had like hours to catch up on talking.
Fill you in on the whole experience. Those epidurals are powerful. Deep pressure. There's a lot of different approaches out there towards that process, and I'm learning all about all of them. Obviously, like in the conservative care world, you see and hear and you get inundated with a lot of the natural styles of childbirth, which is good stuff. I think it's very, very helpful, especially when you can combine it with the amazing marvels of modern medicine.
Are you doing some hybrid?
In terms of our birth plan,
Yeah.
Marissa really just wants to kind of play it by ear as best she can. Wait as long as possible, labor at home as long as possible. So you feel a little pressure here. Breathe in. And exhale loose. Good. Good. A little more here. Good. So in terms of, like, there's a lot of techniques that I know from a muscle work and a body work that I can help her out with in the beginning stages. And then she's going into transition. And then I'm just working on my coaching skills too. There's something called the Bradley method that I'm kind of reading about. That's one of those natural approaches. But then we've got a pretty kind of, I wouldn't call her standard, I would just say she's conservative OB. So,
Yeah.
you know, we're going to take her advice too. I mean, she probably mitigates risk really well in the grand scheme of things. Breathe in. And relax easy. Good. Smooth exhale. Good. Smooth release. Good. Relax your shoulders. Good. Breathe in. And exhale. Let that shoulder drop. Let that drop. Okay. Look forward for me just a little bit, Mike. Good. Breathe in deep. And exhale. Drop your chest. Good. Easy. So pop your feet on there. When you're ready, come on your side. So I came in with sprain strain. It's called facet syndrome. It's a generic way to describe that the joint's irritated and your low back. Irritation over time can happen, or it could be acute, like he was talking about, where he was just miserable coming in after working on the floor in that position that really aggravated his back. Our primary goal is to treat the tissue at first to help with the pain. So getting this to move better, as well as changing the environment through dry needling and exercise and soft tissue work. Once he's out of that phase of care, so around 4 to 6 weeks, I want to transition to getting Mike strong again and giving him a program that spares his spine but gets it stronger at the same time. So there's a healthy way to work out your low back in the beginning, coming from a problem like this, and that's what we've designed for him coming forward. Cool. You can relax here. Good. Take a deep breath in and exhale. Good. Smooth and easy. And focus on your shoulders opening up. Let this drop. Good. Take your time. Come on to the other side. So I bring a towel here just to protect his knee from my knee when I'm setting him up for this adjustment. It just, honestly, it just makes it more comfortable if you're wondering why I'm doing that. Take a deep breath in and relax. Good. Good. Again, I want you to just put your hand like so. Good. Again, breathe in and exhale. Good. All right, a little quicker on this side just because it's a little tighter, right, Mike? Good. And let your shoulders relax. Good. Let this fall. Good. On your back. Cool. And relax everything. Let the legs drop. Good. Nice. Okay. Now let this fall for me. Let the hip come to me. Let your shoulders loose. Good. Good. A little tighter here. This bend. Pop those feet on that platform for me, Mike. Oh. Mike, how you feeling?
Good. Feel good.
Right on. I appreciate you doing the video and just sharing your experience. It really does mean a lot to us that you're willing to do that. Thank you for watching. If you're interested or if you want to find out more about finding a good chiropractor near you, just comment below. We're happy to reach out to you and help you find that person. We're just about giving back, so we appreciate your support. Peace.